Dizziness testing. This is probably the most important aspect of the special tests. The patient is complaining of cardinal signs, that is, definite central nervous system signs and symptoms that have not been diagnosed previously by the physician. You don't need to do this test on. You simply refer them back to the physician and let them sort it out. The patient is reporting non-cardinal signs and symptoms, or the patient that you are going to do a treatment or a test on that's going to threaten the artery, requires dizziness testing. So the first part of this test is the reproduction of their symptoms. Can you reproduce their symptoms by changing the posture of the head and the neck? And if you can change that, then you move into the second part and try to differentiate what's causing those symptoms. Okay, now if we take dizziness as the symptom, one of the first things that could be causing it is postural hypotension. So one of the ways to check this, can you move over towards me, is after having the patient lay down for a little while like this, we'll have them sit up suddenly, and I'll just stabilise the neck and the head like so. And when I count to 3, Beverly, I want you to sit up as quickly as you can. 1, 2, 3. And you try and keep the head and neck as still as possible, so that you're not changing anything in the neck. All you're moving really is the vestibular system, and you're possibly changing the blood pressure. Now, if they get dizzy, it could be vestibular or it could be hypertension. So again, I can check this by sitting them down suddenly. When I count to 3, we'll sit you back down, okay? 1, 2, 3. Good. If they get dizzy on the way down, you know that that can't be postural hypotension, okay? So you're left with the vestibular system. If this isn't a factor, then we can move on to the cervical tests. Now, you'll graduate these tests usually. And we'll start with rotation. So I'll rotate the patient's head to the right, have them keep their eyes open. I want to keep them in this position for about 30 seconds or until the symptoms are reproduced. So I'll ask them again to count back to from 30. 30, 29, 28. Let them count down. If there's no problem, then we'll bring them out of the position and then bring them into the other rotation and test that, same way. If there's no problem here, then we can go into extension. So we'll just have her extend her head. Now don't do this over the end of the bed, it's a little dangerous. It's a lot more stress than you need. And again, same thing here, count to 30 backwards. If there's no problem, take them out of the position. And then we can move into combined rotation extension, like so. First one way, and then the other way. Again, both for 30 seconds. And now if there's no problem, we can maximise the stress by putting them in the combined rotation extension position and applying traction. There and there. And the traction should be held for about 30 seconds if you can manage it. Otherwise, you can only hold it for as long as you can. If you haven't managed to reproduce the symptoms with this final stress, rotation, traction and extension, then I think it's a fair bet that there isn't anything particularly wrong with the vertebral artery, at least that you can reproduce. On the other hand, if you've reproduced cardinal signs or symptoms, the patient is immediately referred back to the physician. No further testing is required. If we reproduce non-cardinal signs, say right rotation, producing dizziness, then we need to then try and differentiate the cause of the dizziness. And the first test we can do is, if we have Beverly sit up, will be body rotation. And this will help differentiate vestibular dizziness from the cervicogenic dizziness, whether it's cervical joint or the vertebral artery. So to do this, I'll stabilise the patient's head, keep that still, and have the patient spin their body around so their feet are pointing that away. Now, I'll keep her here for about 30 seconds or until she gets dizzy again. If she doesn't get dizzy, as I'm doing this particular test, but she did get dizzy when she was laying down, then it's almost certainly vestibular in origin because I've kept the vestibular system out of the equation. If she does get dizzy, then the problem lies somewhere in the neck. And again, this could be joint or it could be arterial. Now, I've deliberately spun her legs over the end of the bed rather than starting from the end of the bed and bringing her this way. The reason for that is that if she does pass out on me, then I can simply drop her back on the bed that way. If she's actually sitting in this position, say facing this way, she's come from here around to there, and she goes, then she's going to tend to fall backwards rather than back onto the bed, she'll go onto the floor. So try to arrange it so their feet are over the end of the bed. If it was extension and rotation that produced it, then put the extension on first and then get them to turn under the extended head and basically just reproduce the test that way. If this test reproduces symptoms, so I've got a cervical problem, arterial or joint, this can be really quite difficult to differentiate. One way of doing it is Hotard's or Hotant's test. There's various spellings for this thing. And this is a sort of a variation of Romberg's test, and it relies on the loss of proprioception to make your diagnosis. We'll have the patient put their arms out in front of them and close their eyes, and just leave them like that for a few seconds and see if they lose position sense in one or both arms anyway. Now, as you're doing this, stand behind the patient in case they lose body sense as well. If they lose position sense without changing their head position, then it's not a vascular problem. It may be cerebellar disease, it may be damage from the injury or whatever. But then we'll put them, if that's okay, keep your eyes closed for me, we'll get them to turn their head in the direction that made them dizzy. In the case we were discussing before, right rotation. And we'll keep them there for that 30 seconds. And we'll look for this loss of position sense in one arm or both arms. Okay. Now, if it's really positive, what you'll actually see is the beginning of a flexor withdrawal reflex. They'll come in this way, and their fingers and thumb will come together, and you'll start pulling back this way. That's a very positive sign. If Hotard's is positive, that is, they do lose position sense in one arm, particularly if it's a withdrawal reflex, then the assumption that you should be making now is that it is vascular. If it's marginal, this test, and you really can't determine, or if they don't lose position sense in the arm, you can't say it's not vascular. So then it comes down to a judgment. If you refer it back to a physician, you haven't really got anything hard to let them know about. On the other hand, you do run the risk of doing them damage. So your first few weeks or few days of treatment is going to be very gentle. And what I'd suggest you do is maybe try a soft collar with them. And if that brings the cervical symptoms down, locally, then it should also change the dizziness from the cervical joints. So if you find that they're still getting as dizzy, as nauseous as they were before, but the local signs and symptoms are reducing, then it's time to have a word with the physician and just explain your dilemma. All right. So essentially, there's the routine scan plus a special test. What we're left with now are peripheral screening tests.